wherever you might be this wonderful morning. These are the dot of 8 a.m. right here in the studio of Noble 107.1 FM, and this is a wonderful program that we are bringing to you to mark the World Malaria Day. Today being the 25th of April, every year is marked to be the World Malaria Day, and WHO, that's World Health Organization, has themed this year to be zero malaria, draw the line against malaria, and also the theme with World Health Organization um, is that malaria, zero tolerance to malaria. And so, right in the studios of Noble 107.1 FM, I have the opportunity of speaking with this morning pharmacist Mrs. Ike Amogechuku Joy, who is here to represent RX Go Pharmacy, and she will be shedding some light on the issue of malaria for the next 10 minutes or thereabout. Good evening, good morning, ma. How are you doing?
I'm fine, thank you very much.
It's nice to have you in the studio today to talk about malaria. I'd like to ask you, first of all, what is malaria?
Malaria is a tropical disease and is a vector carrying disease.
Okay.
The vector is a female Anopheles mosquito,
Okay.
and the vector transmits the malaria parasite into a human being. So it's
Okay.
not human to human, it's vector to human.
Vector to human.
Yes.
Oh, okay. I would like to ask also, what are the symptoms that we should look out for in someone who is having malaria?
Okay, there's malaria actually comes as there is severe malaria
Okay.
and there is a non-severe malaria.
All right.
So for the non-severe malaria, the common symptoms are fever, chill, abdominal cramps or pains.
Okay.
Some people come down with vomiting and diarrhea, and then headache. Most time it starts with headache and fever. But for the complicated or the severe malaria, it can come with confusion. You see someone that is mentally sound acting very confused.
Wow.
So that one is very dangerous. They need to rush that person to the hospital.
Okay. All right. Now, when someone starts showing signs of malaria, what are the measures that are meant to be in place to cure the malaria? We'll look at the preventive measures also that will mitigate it before getting to the person. But now that the person already has it, what do you think can be done?
Okay, so you can't really say if you have malaria or not.
Okay.
Because it mimics so many other conditions like common flu.
Okay.
So someone cannot just say they have malaria. The only way to confirm is to do a test.
Okay.
So the advocacy here is do a test. Then if it comes out positive, then take the anti-malaria drug.
Okay.
In recent time, we have the World Health Organization and even the Nigerian Medical Professional Association has advocated the use of combination therapy.
Okay.
Yes, so you go for ACT-based malaria drug if the test is positive. But if it is the severe symptom that the person is having, that person needs to go to hospital because it can only be treated by intravenous way of administrating the drugs, and it's not something someone can do on their own, do in their house.
So basically you're saying that self-medication is not advisable at a point in time. All right, so let's look at preventive measures. How do you keep yourself safe from malaria so you don't have to have the flu before getting the cure?
Okay, so the first thing is to prevent the mosquito from biting you.
Okay.
I know it might sound very far-fetched, but it can be attainable. In my final year in University of Ibadan, we were told by our lecturer that he's conducting a research on people that have not had malaria for the past 10 years.
Wow.
And some of us were asked questions. Me, for that time, the last time I had malaria was 2009.
Wow.
And in 2017 I came down with malaria, so I was not eligible to be used as a subject for the research. Yes, but it's attainable. We can do this. you just have to prevent yourself from being bitten. The way to go about it is to get a long-lasting mosquito-treated net.
Wow.
You can walk into any pharmacy outlet and get it for your children, for your wife. So you put it on your bed and you put it in the proper way. You don't just hang it open and then the mosquito has gone inside. You make it come down to the floor, or you tuck it into the mattress, so that there is no air, there is no space for the mosquito
to move in.
Yes. And then when you are outside, especially at dusk, that's in the night, because that's when mosquito do most of their activity. So you can rub a mosquito repellent cream, or you can wear a very long clothes that will cover your hands and your leg, or even wear stockings, so that the mosquito will not see a skin to bite. Yes.
Okay. All right. Thank you very much for shedding light on that. And I understand that you have one or two things to add to what we've spoken about so far.
Okay. So my contribution is that when you have a sign, you can walk into a lab and request for a malaria test, so that you don't just move into a pharmacy and start asking for malaria drugs. Some will come in and tell you they have malaria, and it might not even be malaria. So you need tests. Even it has been done in such a way that testing is accessible, even drugs is accessible too, so that we can, because recently we've seen that in 2020 South Africa and Ghana are on their way to becoming free from malaria, and Nigeria is way behind. We did not reach our 2020 milestone in eradicating malaria that the World Health Organization has set for the African nations that are battling with malaria. And every year Nigerians lose 1.8 billion naira due to malaria burden. So we need to, if we want to save our life, especially children below the age of 5 and pregnant women, these are the target. They are the ones that have the highest death rate. So if your child is below 5 years or your wife is pregnant, you need to get a mosquito treated net for them. And also, when you are traveling to the village, you need to get a preventive therapy. That most people don't know there is preventive therapy. You need to be on preventive therapy, so that you will not expose yourself to malaria. Most time when children come down with malaria, they don't even know that they have anemia, because another thing that comes with the malaria is anemia, and it's also dangerous for both the mother and the child.
My next question would have been, what category of people are actually very easily attracted to malaria? What category of people gets this particular disease at the snap of a finger? Is there an age group, or is there a sex that actually gets malaria at the snap of the finger?
Like I said before, people that have low immunity, like pregnant women and children below 5, and also HIV patients. And also for people that are sickle cell, it's dangerous for them to come down with malaria.
All right. I have been speaking with pharmacist Mrs. Ike Mogechuku Joy, who is actually superintendent pharmacist at RX Go Pharmacy, which is actually located at Heritage Mall, Dube, Yano Church, and also at Urugun. You might want to have one or two questions for her after this. This is all in a bid to have a very elaborate sensitization and public awareness as to what today signifies, which is the World Health Organization has actually marked today to be the Malaria Day, World Malaria Day. You can get across to her via call or WhatsApp on 0901 051 5756. I take that again. You can actually call her or send her a message on WhatsApp via this number 0901 051 5756. 0901 051 5756. And also you can get in touch with them on Facebook at RX Go Pharmacy, also on Instagram and Twitter at RX Go Pharmacy. I want to appreciate you very much for coming on the program today. It's an honor to have someone go through the stress and through this particular process of sensitizing people as regard the World Health Organization's Day for marking malaria. Thank you very much for listening. My name remains John Ashington Day at Dejumo, and this is number 107.1 FM. Our program continues shortly.